Good evening. Welcome to KQED Newsroom. I'm Thuy Vu. On tonight's show, we're going to examine the challenges facing two different segments of our population, people over 65 and people under 18. Later in the show, we'll talk with the man responsible for making sure tens of thousands of Oakland students succeed in school. But first, researchers from around the globe are gathering in Washington this weekend to discuss one of the biggest health threats to senior citizens, dementia. More than 5 million Americans over the age of 65 have the most common form of dementia, Alzheimer's disease. That number will increase by 40% in the next 10 years, according to the Centers for Disease Control. Alzheimer's is the 6th leading cause of death in the U.S. That disease and other forms of dementia take a devastating toll on patients, families, and caregivers. UC Berkeley journalism student Brittany Johnson documented her grandmother's struggle with dementia in this short film.
My name is Mary Helen Taylor Sampson. I am the mother of 12 children, and I loved each one of them. I was born August 19, 1924, in Fayetteville, North Carolina. The South was always hard on blacks. They didn't want to feel that you were equal with them. But I always felt like I was as good as anybody else. I had no inferiority complex at all. In fact, I was a little arrogant. I thought I could do anything.
I met grandmama in high school. I think we were in, 10th grade. Dementia was beautiful, and she was so kind and so nice, you know. I proposed to her in a letter. I wrote her a letter. I was in New York and asked her would she marry. And she wrote me back and said, yeah. This one here,
What you do?
just when we lived in Poughkeepsie on Perry Street, and everybody was very, very young. There's George, Paula, Gwen. The dementia started about 10 years ago. I try not to show it, but I take it very hard.
What are we doing today, honey?
We're going to church today. Today is Sabbath, so we'll be at church. Why should a person like her, you know, have to go through that? Knowing what type of person she was, sometimes I feel that she don't deserve that. A person that always tried to do the right thing, tried so hard to do everything right.
I think I've had a good life. I was fortunate to marry a good man. Everybody talked about me. Every time I look around, she's pregnant again. She keeps having those children. But I didn't pay them a bit of attention. I loved my children. I was determined that each one of them should have an education. I worked nights for years. I can't even remember how many years. My husband would pick me up in the morning from work and drop me off at the home, and he would go to work. So I got very little sleep. In fact, people told me I was going to die and leave my children, but it hasn't happened. I'm still alive. I'm waiting when I get on to the party. Huh?
Yeah. She'll ask me, what do I do next? What do I do now? You know, I don't mind it, you know.
Why?
Because I love her that much. I'll do anything she wants me to do.
Well, I just see me living to a good, ripe old age and enjoying my children and my grandchildren and my great-grandchildren. That's what I see for me.
And joining me now are two researchers who are investigating different aspects of dementia. Dr. Lennart Mucke is the director of the Gladstone Institute of Neurological Disease and a professor at UCSF. Also joining me is Dr. Dolores Gallagher-Thompson, a professor at Stanford University's Medical School and the director of its Geriatric Education Center. Welcome to you both. And certainly the story that we just saw is very sweet, but you also get a clear idea of the difficulties and challenges of dementia. And so, Dr. Gallagher-Thompson, I wanted to ask you, first of all, what are some of the stressors for caregivers?
Well, I think one of the biggest stressors is the changes that keep happening to their loved one, changes that you don't have control over, changes that are not totally predictable, and usually changes that are going in a negative direction. So the person isn't able to do what they could do before. They don't remember things, current things. She remembered very well things from her past, but currently I'm sure she's quite forgetful. So that's a real stress for families. But another aspect of it is that families themselves get overburdened. You know, they feel like, what else is going to happen now? What's coming next? Can I cope with it? Will I be able to really manage? Or am I going to not be able to continue in this role? And most families want to continue. So part of what we try to do is help families learn that they have skills within themselves. They have coping strategies, and they can learn more about what to do when they're confronted with these challenges. So
what are some of the coping strategies that you recommend to families?
Well, one that works really well is something that they did show on the video, and that is the idea of sharing pleasant activities, doing positive things together. When you're very stressed caring for the loved one, that's a hard thing to do, because most of your time is spent taking care of them in ways that are often unpleasant. You may have to help them eat and bathe and go to the bathroom and dress themselves. This is hard on families, especially when there's a big age difference, like a daughter taking care of a parent.
Sure.
It's a real role reversal, right? So, but we find that by doing things together, things that they both enjoy, that this can really improve the quality of life for both people, and it takes some of that stress away.
And Dr. Mucke, what differentiates Alzheimer's from other forms of dementia?
Yeah, so that's an interesting question. I'm asked quite often, what is the difference between dementia and Alzheimer's disease? And so Alzheimer's disease is the most common form of dementia, but there are other types of dementia. For example, frontotemporal dementia, which presents more with behavioral abnormalities like disinhibition rather than with the memory deficit that is most typical for Alzheimer's disease. And there are some other forms that present with episodes of unresponsiveness or visual hallucinations and things of that sort. And importantly, there are a number of dementias that are actually treatable, that are due to vitamin deficiency, very rare form, vitamin B12 deficiency, or to low thyroid function. And those are things that a doctor can check out and diagnose and very often treat if they haven't gone too far down the line.
So those other forms of dementia, as you said, are treatable, but what about Alzheimer's? It's obviously one of the top 10 leading causes of death, but it's my understanding that it's the only one on that list where it's not preventable, you can't slow it down, there's no cure.
You're right. So unfortunately, there are no treatments treatments available today that can either prevent, halt, or reverse the disease. And that is what we must achieve. And I think it's very important to realize that Alzheimer's is not just sort of an inevitable byproduct of the natural aging process. It is a true ferocious disease like cancer or AIDS or heart disease, and it will have to be tackled in exactly the same manner. We need effective medicines for this condition that we currently still do not have.
And Dr. Gallagher-Thompson, you know, you deal a lot with minority caregivers as well. What are some of the differences that you've observed? What are their different needs?
Well, one big difference is really seeing this whole thing as part of normal aging for a long time, often until it gets to the point where there are significant behavior problems, and that's when the family reaches out for help. But up until that time, they may go to culturally relevant and traditional healers. For example, in the Latino community, they may go to the curandero, or they may go to church and believe that prayer is going to reverse this. In some of the Chinese communities, it would be the herbalists. So traditional forms of help are sought. Oftentimes, these people helped other ailments that the family had. So they think they'll help here with dementia. But after a while, it's really not sufficient. So that's one issue, is understanding, learning that there are resources that are culturally tailored. And it's also learning that within the family, there's a great deal that one can do to support one another. So it's true that there is no cure at the present time, and it's certainly true that the scientific world is trying very hard to find that. But in the meantime, we have millions of people globally who are struggling, and they need to have some help. So one of the big sources of help is right there. It's the family. If you know how to bring the family together to work collectively to help. And in the minority communities, we see that the family is brought in more often. We make a great attempt to do that, and we find that that helps to ease the burden considerably.
So the understanding of the needs of minority communities is certainly evolving, but the research has also been evolving. Over the past 10 years, Dr. Mucke, what have you and other researchers learned about dementia and Alzheimer's, and how has that changed how you approach these conditions?
So through groundbreaking genetic studies, we have understood that the disease has multiple causes. So different people get the disease probably for different reasons. We know that there are some very aggressive genetic changes, so mutations in genes that can cause Alzheimer's disease, where everybody who has that mutation is going to get the disease for sure. And we've understood now through large-scale genetic research that there are risk factors, just like there are risk factors for lung cancer and for cardiovascular disease. There are genetic risk factors for Alzheimer's disease. So we understand much more about the different causes. And I think an important realization for us is that this multifactoriality will have to be matched with a multi-pronged therapeutic approach. It's very unlikely, in my view, that there will be a single blockbuster drug that's going to take care of all Alzheimer patients. We will need a whole toolbox or armamentarium of drugs.
Much like the AIDS epidemic, how it took multiple drugs.
Absolutely, and just to refer back to something that you said, you know, what we saw at the beginning of the AIDS epidemic is that people tried all kinds of things, you know, chanting and herbs and lifestyle changes, and unfortunately it didn't help. And then medicine cracked open this field, and now nobody has to die, really. And it's in the combination of drugs that were rationally designed, focused on the HIV virus, but that has only 9 genes. It's a very simple organism. And here we're dealing with the complexity of the human mind. So it's a much harder challenge.
So you talked about the genetic factors. Does that that mean, though, that if you have that gene, you will definitely get Alzheimer's, or if you have a family member who has Alzheimer's, that you will get it?
So, you know, there are different genetic risk factors. There are those that actually determine with almost 100% certainty that you're going to get the disease. They are very, very rare. They make up less than 1% of all cases of Alzheimer's disease. But then there are other genetic risk factors, for example, apolipoprotein E4 or ApoE4, which is like there's good and bad cholesterol, there's good and bad ApoE. And if you inherit the bad ApoE, your risk of getting Alzheimer's goes way up. So for example, if you got one of those genes from your mom and one from your dad, so you have two of them, your risk of getting Alzheimer's in your early 60s can go up 10 to 15-fold. So that's a huge leap. Yeah. So these are powerful risk factors, but they don't mean that if you have those risk factors, it's 100% sure you're going to get it, right? So just like somebody who smokes may or may not get lung cancer, and somebody who has high blood pressure and high cholesterol levels may or may not have strokes and heart attacks, it's clear these are important risk factors.
Are there some promising medical developments now on the horizon? Will we see an effective treatment or cure soon?
So, you know, how soon, I'm not 100% sure. In the early 90s, when all these insights from genetics emerged, I think many of my colleagues and I thought that we were going to be maybe 5 or 10 years away from a firm cure. But I think that we now are beginning to develop treatments that aim at the root causes of the disease, not just at the symptoms. And there are some very exciting new treatments in late-stage clinical trials that I think make me very optimistic. And there are many more coming into the pipeline focusing on these different factors like ApoE or tau or chronic brain inflammation. And I really think that in the next 5 to 10 years, we will hopefully see at least various of these new therapeutic strategies move into the clinic and to the bedside of patients.
Well, that we would certainly hope so. Dr. Gallagher-Thompson, what advice would you give to a newly diagnosed patient and their families?
Well, first of all, don't give up hope. There are things you can do. So just like we learn to adapt to other chronic illnesses, we all have them in different forms, and we learn to live with them. So dementia is similar. It's a long-term chronic illness. It does go through stages. It's true there is a downhill course, but at each stage along the way, there are things that we can do to mitigate the impact that it has on the patient and on the family. So for example, in the early stages where people are forgetful and they repeat their questions and they get lost easily and so forth, there are specific strategies that you can use that will help to reduce the frequency of that behavior. And organizations like the Alzheimer's Association and here in San Francisco, the Family Caregiver Alliance, help families learn what those particular strategies are. In the middle stage, when you have other kinds of problems, wandering, disinhibition, disrobing in public, things like that, there are other techniques that you might use. Okay. So the message is hope.
Well, and that is a good message to end on, because certainly it's a very devastating disease, dementia and Alzheimer's, but optimism is what you pointed out, so thank you both. Dr. Lennart Mucke with the Gladstone Institute of Neurological Disease and also with UCSF, and Dr. Dolores Gallagher-Thompson with the Stanford University School of Medicine. Thanks to you both. Last year, Antwan Wilson became superintendent of the Oakland Unified School District, the second largest in the Bay Area after San Francisco. A little over 37,000 students attend classes in that financially struggling district. And in the school year that ended last June, the high school graduation rate was less than 61%. That's well below the state average of 80%. Mr. Wilson joins me now to talk about his first year in the job. Welcome.
Thank you for having me.
I see you're wearing your Oakland shirt there with pride.
Absolutely.
Let's lean back a little bit so we can see what it says, Oaklandish.
Oaklandish.
What does that mean?
Well, I think it's just about pride in the city, the swagger that the city has, and being proud to represent the town. And so I'm certainly excited to be a part of it and have an opportunity to represent Oakland.
It is certainly a city with much to celebrate, as we know with the recent Warriors win.
Absolutely.
And beautiful Lake Merritt, many beautiful neighborhoods as well. But you also have quite a few challenges, and we talked about that in the introduction, the low graduation rate. Given that it's so low, why should families want to be in the Oakland Public Schools? Make the case for your district.
Well, Oakland is a tremendous district, first of all, because it's in this tremendous city of Oakland. We're a tremendously diverse district, and we're focused on being a district where every student thrives. And so we invite parents to participate in our process of becoming an outstanding school district. And, you know, our focus is on academic achievement. And so what I would tell parents when they're considering our district is to look at the fact that our student achievement is increasing. Look at the fact that we have more students reading on grade level, and it's a different students from throughout the city. And I would say look at our focus on college and career readiness and the fact that we're seeing improved outcomes in those areas, and know that they can help us get even more done.
What else do you need to do you think, to for Oakland schools to succeed?
Well, I think our focus has to be on supporting all children and focusing on building on our strengths. You know, Oakland is a city where we have tremendous strengths around community engagement. We have a great deal of innovation and ingenuity in Oakland. We have a number of people who have a great deal of pride about being from the city, having graduated from Oakland Unified School District, and that's tapping into those resources. And they're doing a lot of amazing things and a lot of different levels. Our students need to see that, and learning from their example, they will be successful as well.
What are the biggest challenges to that?
Well, I think some of the biggest challenges is just some of the past perceptions, maybe some of the past mistakes, and then funding. You know, just making sure that we continue to do the work that we are doing to improve our fiscal situation, which I'm quite proud of the fact that we have made some tremendous progress in that regard.
A lot of the challenges, though, also lie outside the classroom, as you know. You have a community where some Oakland students have been victims of violent crimes or have been witnesses to very brutal crimes. How do you go about addressing all of that? Because that very much goes to the heart also of how they perform in school.
I appreciate the challenges that our students have in terms of what they face in their daily lives, because those challenges, being around crime, victims of crime, witnessing violent crime, I mean, that was very much a part of my upbringing, very much a part of what I saw. I mean, the violence, the shooting, I mean, all of that was a part of my lived experience. And
you grew up in Wichita, Kansas, and also Lincoln, Nebraska?
I grew up in Wichita and Lincoln. Had to deal with the fact that in Lincoln, in Wichita, my mother being shot, and dealing with all of those different types of things. So yes, I understand it. So what do we do with that is we work to make sure, first of all, that they know that the superintendent understands that. That's been part of his lived experience. Two, to recognize that we know that we have to be a full-service community school district that is there to meet the needs of our students regardless of what they are, the social-emotional needs as well as their academic needs. And then it's about partnering with our community to come in and provide the support to our students that they're going to need, with the #1 focus on making sure they know that they come to us with great assets, strengths, and they will be successful.
In June, Mayor Libby Schaaf created a new Director of Education position. This is a policy job. How do you feel about the new hire, David Silver? He comes from the nonprofit sector. And is this position even necessary? Isn't setting education policy your job?
I'm very excited about my collaboration with Mayor Schaaf, and had absolutely nothing but great thoughts about her pursuing an education agenda. We've done this in collaboration. And what I would say is ensuring that our children are successful in Oakland, that's our job. And in no way is this a threat to us or me as the superintendent in Oakland. This is an opportunity to partner with the city around the outcomes we want to see for our children, which is that they all graduate college, career, and community ready. So this is awesome for us.
Last month, the Oakland School Board voted unanimously to end the use of what's called willful defiance, and this is often a vaguely defined category for all types of misbehaviors, and it's used as a grounds for transferring or suspending a student. What is the significance of that move?
We recognize that it's important that students are in school, that the environments are safe, that they are respecting their teachers, and we believe that we can get that done by lifting up restorative practices, making sure that students understand that their behaviors, while inappropriate, are not going to be an excuse for them to miss out on learning, and that we will make sure that we address their any inappropriate behavior that may come, and ensure that we also continue to focus on their learning. And so by emphasizing our focus on restorative practice, ending suspensions for willful defiance, and normalizing or standardizing disciplinary consequences across the district, which was also part of that vote, we think that we are on the path to ensure that all of our students get what they need to graduate from high school.
I want to also talk about your the relationship between police officers and students of color. Your district has its own police department. What are you telling the officers about how they need to relate to the students and vice versa?
We believe that our police officers are an important part of uplifting school safety. So restorative practice, building relationships, social emotional learning, which really is speaking to the relationships that we establish with each other, including our students. We're telling our officers that's important. And we hired a chief of police, Jeff Godown, who is uplifting those same messages. And not only that, we're providing training for those officers.
I want to also ask you about charter schools. Do you view them as a partner or a competitor to the city schools? Well,
I absolutely see that we have 48,000 students in Oakland, and about 11,000 of those students are in charter schools. And I see that charter schools are a partner. Now, it's important that we recognize that while we're partnering with charters, that we're going to do everything that we can to uplift the schools that we directly run. We're going to do everything that we can to support them and help them be successful.
You alluded to this earlier, your background, your mother having seen her men shot. You were the son of a single teenage mother. Your family was poor. How did that experience shape you? And what lessons have you gotten from that you're now taking and putting into practice in the Oakland School District?
Well, I had a great example, you know, for me, my mother. My mother didn't allow me to make excuses. I mean, so we had a lot of things that you just mentioned that were extremely difficult. I watched her work extremely hard, and we went through a number of challenges, but I also saw a great deal of determination. I saw a great deal of pride. I saw a great deal of belief and agency. It was about being respected and demanding respect. It's one of the things that endears me to Oakland. I see that same type of resiliency here. And so what that does is it puts in me a desire to ensure that students get what they deserve, that they get the opportunity that I got to be successful. And I bring that in my leadership here in Oakland, that fight and determination that I saw modeled for me and that I see reflected in so many of our parents, of our students.
Well, I wish you much luck, and we look forward to hearing from you in year 2 and seeing how things are going. Superintendent of Schools in Oakland, Antwan Wilson, thank you so much.
Thank you for having me.
And that does it for us. Thanks for watching. For all of KQED's news coverage, please go to kqednews.org. I'm Thuy Vu. Have a good night.